Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, I'm Carol Fleck, and on behalf of the Attitude team, I'm pleased to welcome you to today's ADHD Experts presentation titled What is Hoarding versus ADHD Clutter? Defining Characteristics and Strategies to Help. ADHD can make it hard to stay organized. Difficulties with decision-making, distractibility, and impulsivity can easily give rise to a disorganized home or office. To an untrained eye, ADHD clutter may be confused for a hoarding disorder. Differentiating these two related but distinct conditions requires a clearer understanding of what hoarding disorder is. Today's webinar will cover the causes and manifestations of hoarding disorder, guidelines for diagnosis, common comorbidities, the role of attention deficits, and best practices for successful treatment outcomes. Leading today's presentation is Dr. Carolyn Rodriguez and Dr. Randy Frost. Dr. Rodriguez is Associate Chair, Associate Professor, and Director of the Translational Therapeutics Lab in the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. Dr. Frost is the Harold, Edward, and Elsa Cipolla Israel Professor Emeritus of Psychology at Smith College. Doctors Rodriguez and Frost are co-authors of the recently published book, Hoarding Disorder, A Comprehensive Clinical Guide. For mental health professionals, peer support counselors, community advocates, and professionals in training, this book will improve the reader's knowledge and skill in treating patients with hoarding disorder. Before I hand over the microphone to Drs. Rodriguez and Frost, I have just a few housekeeping items. Those of you tuned in to the live webinar may submit questions for the experts at any time by navigating to the text box under the video player. To download the slides, click on the Event Resources section of your webinar screen. And if you're interested in the Certificate of Attendance option, look for instructions in the email you'll receive about an hour after the live broadcast. If you are listening in replay or podcast mode, visit attitudemag.com and search podcast number 417 to access the slides, the webinar replay, and the Certificate of Attendance option. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. The latest summer issue is filled with practical advice and tips from experts on social anxiety, toxic relationships, how to bully-proof your kids, and so much more, including a special section on success at school, everything you need to know to prepare your child for a successful year. Subscribe today for your family or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Finally, the sponsor of this webinar is Inflow. Inflow is the #1 app to help you manage your ADHD. Developed by leading clinicians, Inflow is a science-based self-help program based on the principles of cognitive behavioral therapy. Click the link on screen to download now on the App Store and Google Play Store. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without further ado, I'm so pleased to welcome Dr. Carolyn Rodriguez and Dr. Randy Frost. Thank you so much for joining us today and leading this discussion.
Thank you, Carol, and welcome everyone to this webinar. We're going to cover 5 things today. We have a relatively short period of time, so we won't be able to go into a lot of detail on these things, but it'll give you a beginning sense of what this disorder, what hoarding disorder is all about and how it's related to ADHD. We're going to first talk about diagnosing the disorder and some of the phenomenological features of it, because those are important to understand. We'll spend quite a bit of time on that. We'll talk about co-occurring conditions. we'll talk about etiology or our best sense of how this goes together, how we can think about causal relationships with respect to different characteristics and behavioral features that lead to this problem. And then we'll talk a little bit about the overlap between ADHD and ADHD-related phenomena and hoarding. And then we'll talk a little bit about treating hoarding, the kinds of things we do, and how those overlay a bit with ADHD kinds of issues. So I want to start by talking about the diagnostic criteria. In 2013, the American Psychiatric Association included hoarding disorder for the first time in its Diagnostic and Statistical Manual of Mental Disorders. It was listed as one of the obsessive-compulsive spectrum conditions in the DSM. So it was in the same category as disorders like obsessive-compulsive disorder and body dysmorphic disorder and so forth. There are three primary conditions. These are called inclusion criteria. And these three things really define the nature of this problem. The first of this is criterion A, persistent difficulty discarding or parting with possessions regardless of their actual value. So here we see that the focus is not so much on discarding possessions, but parting with them in some way. So the folks with this problem have difficulty not only throwing things away, but also getting rid of things by selling them or donating them or even loaning them to other people. Anything that takes it out of the person's immediate possession is a difficult behavior for folks with this problem. Now, this has to be a persistent difficulty. It's not something that happens over a short period of time. Many times people get inundated with things, especially when family members pass away, for instance, and they inherit a lot of possessions and so forth. But this has to be persistent over a long period of time. And the other caveat here is that this is regardless of the actual value of these objects. Now, that's in part because early on in the diagnostic manual, the inability to throw away worthless or worn out items was considered a diagnostic criteria for a personality disorder, the obsessive compulsive personality disorder. But what we've learned in the research over the last 20 years or so is that this really does not characterize hoarding disorder. People with hoarding disorder save things that others may consider worthless and worn out, but they also save everything else that comes into their possession. So it's really not the actual value that has any determining factor in the definition. The second criteria B, is this is due to a perceived need to save the items and distress associated with discarding them. So this isn't something that builds up because someone just doesn't have the motivation or the energy to work through all their stuff. But there's really a reason why the person is saving this item. And we'll get into that a little bit more when we talk about etiology. And the third feature here of the disorder is not so much a behavior, but a result of the first two of these. Criterion C is that the accumulation of these possessions that clutter active living areas and substantially compromise their intended use. So if someone has an attic full of stuff or a garage full or closets full, but the living areas are unaffected, it would not be considered hoarding disorder. It's only if the living areas are cluttered substantially so that they can't be used for their intended purposes. Now, there's one caveat here, and that is if the living areas are uncluttered, if that's because of interventions of third parties, like other family members, house cleaners, or authorities, then it can still be considered a hoarding disorder. So these are the three primary inclusion criteria for hoarding disorder. The fourth of these criteria, D, is one that really suggests that this causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, including a safe environment for oneself and others. So this is, again, a consequence. Like the clutter criteria, this is a consequence of those first two behaviors that we saw in the definition. Now, the final two criteria are called exclusion criteria. That is, if these other conditions exist it's just that they cause this behavior, then we would not consider it hoarding disorder. So if it's not attributable to another medical condition, so certain kinds of brain injury or cerebrovascular disease can sometimes lead to these behaviors. In that case, it would not be considered hoarding. Same is true if it's accounted for by another DSM-5 disorder. In some cases, OCD, some of the symptoms of OCD can result in this. Certainly major depression can do so, psychotic disorder can do so, and so forth. In those cases, we would not give the diagnosis of hoarding disorder. Now, in addition to these major criteria, we have two diagnostic specifiers. Now, what this means is that when we're making a diagnosis of hoarding disorder, if we decide that hoarding disorder exists, then we have to specify whether these conditions exist. Whether that, the first is that is it associated with excessive acquisition or not? I'm going to talk a little bit more about excessive acquisition in a minute, so let me put that off. But that's one of the specifiers. The second specifier has to do with establishing the extent to which the person is insightful about this. That is, they recognize that this is a problem and they need to do something about it. There are three categories to choose from. One is it good or fair insight? Is it poor insight? Or is insight absent? In which case, the person denies having any kind of problem, doesn't see this as a problem. And we see in the research that comes out is that in research clinics, we seldom see people with absent insight. But in community settings, like health departments, elder service agencies, their reports suggest that as many as 50% show some kind of absent insight. Now, we need to unpack that a bit more, but it does give us pause to make sure we're cognizant of the fact that the people who end up in many of our research projects may not be completely representative of the larger community of people with hoarding problems. I want to walk you through the home of someone with a moderate hoarding problem. Now, this was a very early case of a woman who agreed for me to use these slides for training purposes. And I want to walk through and have you notice certain things about these slides. Keep those in mind as we go through what we're talking about today. The first thing you'll notice is that all the horizontal surfaces are covered. And you can see a couple of things to point out. You see a little corner of the table that's open. This is where she eats her meals, where two children eat their meals. And clearly they can't sit down at the same time to eat. So it's affected the functioning of the family. You also see back in the back middle, the stove. You can see teapot sitting there, and right beside the stove is a pile of papers. So we have a heat source next to a fuel source. So this is again suggests a pretty serious problem with this situation. The other thing I want you to notice is that the variety of things that you see on the table. You can see light bulbs, newspapers, ribbons, egg cartons, wrapping paper, a seemingly random assortment of things. So this clutter is an amalgam of things, and we'll come back and talk a little bit more about that as we go along. This is the dining room in her house. You see things piled almost all the way up to the chandelier. You can see just on the left side a small pathway about a foot wide that's characteristic in many cases here. You also see three blue tops to storage bins. So now what that tells us is that this woman has been trying to do something about this, because she's purchased materials to try to start organizing, but those materials have ended up in the pile that's forming the massive clutter in the home. You can also see this sort of random assortment of things. We have books and plastic game pieces and dishes and so forth in here as well. So again, this kind of randomness that we saw in the last photo. This is the same room from another direction, and I included it because this door that you see is the main entrance to her home. So if there were a fire, she would have great difficulty getting out. Now, she would have to go back through the kitchen and through the garage, which is a sea of things with a small pathway running through it. This is her den, and here we see a different sort of stuff. All the paperwork has ended up in this room. And a couple of things here. You see a little corner of that couch that is a little bit less cluttered than the other part, and that's where she sits. And she told me that she sits there for a couple of hours every day trying to work through this stuff and doesn't make much progress. And what we see when I ask her to show me how it is that you work, so she sort of worked her way through this. And it was clear that typically what she did was pick up something off the pile, look at it, review why she got it, and feel unable to make a decision, and she put it back on the pile somewhere else in sight, okay, so that she could see where it was. And that was to her a way of reminding herself. And we'll come back to that issue in a few minutes. This is the upstairs hallway. And here we see bags filled with gifts. These are things that she's purchased over the last couple of decades and not been able to get rid of. And what happens with her is fairly typical of people with hoarding problems. When she's out shopping, she sees something she really likes, and she can't resist acquiring it. We'll talk a little bit more about acquiring in a minute. In this case, for her, many of these are gifts she's purchased, intending to give them away. And in her mind, when she's shopping, she sees something and she thinks that would make a great gift for someone. Sometimes she has the person in mind. And so she buys it and brings it home. And for her, this is a way she feels of staying connected with other people. This is something that links her to other people. So it's a part of her social sense of self. Now, the fact that she can't quite get this together to give it to other people is a part of the hoarding difficulty that we see. But in her mind also, this is not part of the problem, because after all, these things really don't belong to her. They're really supposed to go to someone else. So this, but yet she hasn't taken care of that. Another thing that we see is in these cases, in at least half of the cases, what we see is some deterioration in the outside of the house, some deferred maintenance, as well as sometimes the accumulation of piles of things outside the house. These are the cases that are more likely to get reported by the health department and lead to authorities coming in and insisting on change or doing something to prompt, in some ways, a crisis in the person's life. The other thing to note is that what we find generally with these cases is that any kind of container the person has access to will fill up. And this car is an example, with everything filled with things. And in this particular case, this car, it would be a difficult one to drive because some of the stuff in the passenger side is sliding over into the driver's side. Okay, so that gives you a general sense of what this is like. Now let's take a step back and work our way through what we've seen. There are three major manifestations of hoarding, and the first of those is acquisition. That is, the stuff has to come into the house some way. The second is saving behavior. That is, the person makes a decision to save something or has trouble getting rid of it. Okay, we can think of that in two different ways. And the third is some level of disorganization. I want to talk a little bit about each of these. First off, acquisition. What we find, and this is an interesting point from the standpoint of diagnosis, what we find is that about 90% to 95% of hoarding cases acquire excessively. And they do so in a number of different ways. The first is buying things. The woman whose home we just toured had a problem with going to New York City. She lives a couple hours out of New York City. She can't go because if she went and walked out on the street, she would invariably see a news kiosk. And she would think to herself, look at all those newspapers and magazines. Somewhere in all of that, there's a piece of information that could change my life. How can I walk by and not try to find it? And the only way she could handle it is to cross to the other side of the street and look away. And then that it didn't even satisfy her. So she avoids the city altogether. So you can see the power of this excessive acquisition for her. She also acquired free things. She had a standing arrangement with the local postmaster that any newspaper or magazine that couldn't be delivered because the address was smudged, she would put them in a box, put it in the foyer, and on the weekend, she would come around and pick them up. We also see some elevation in stealing behavior, although it's not much, only a minority, fewer than 5 or 10% of people with hoarding problems do any kind of stealing behavior. But it is a little bit more than what we see in people who don't have hoarding problems. And then finally, passive acquisition. This junk mail that comes into your house, if you don't get rid of it, that can accumulate as well. So that's the acquisition feature. The compulsive saving or difficulty discarding feature. One of the things we initially thought was, are the types of items that people who hoard save, are they different than people who don't hoard? What we found is basically people who hoard save the same kinds of things as everyone else. They just save more of them. And so clothes, newspapers, books, containers, these are the biggest volume items that we see in the house. The issue of worthless and worn out, we've already talked a little bit about. For people with hoarding problems, these are generally not worthless and worn out items for the most part. The other feature here about the compulsive saving or difficulty discarding has to do with the nature of the attachments that we see. So we can think of them in 3 different categories: sentimental items, instrumental items, or things that are useful, or intrinsic items. Let me just give you examples of these. For the woman whose home we toured, as we worked with her, she was going through paper items and she pulled up a receipt, 5-year-old receipt. It was from a department/grocery store, and she remembered some of the items. She still had some of the items. She put it in the recycle box and started to cry. And what she said was, I feel like I'm losing this day in my life. And if I lose too much, there'll be nothing left of me. So you can see this attachment, it was tied up with her sense of identity, her sense of self, which made it difficult for the other things. Instrumental attachments, I didn't show you the other side of her kitchen, but the space between the refrigerator and the woodwork around it. Hers was stuffed full of the cardboard tubes from toilet paper rolls. And what she said was these would make great art projects. And although she wasn't an artist, didn't have a project in mind, she said, I'm saving them for my son's art teacher. But her son's art teacher didn't ask her to and didn't even know about this. But so she could see a use for something. And if she got rid of it, she said, she would feel guilty for wasting it. So again, it's a second kind of motivation. The third has to do with intrinsic value. I came one day and her eyes lit up. And she said, I've got to show you something. She ran into the other room and she came back with a large clear plastic bag filled with bottle caps. And she said, look at these bottle caps. Aren't they beautiful? Look at the shape and the color and the texture. Now, for me, when I see a bottle cap without a bottle, my only thought process is that it's trash. Where's the trash can? But for her, it's a florid, it's a magical kind of experience where she appreciates the physical qualities of these things that most of us would consider trash. And the final feature is disorganization. And this is expressed in both the condition of the home and in their behavior. So the clutter that we see is an example of the disorganization. There's a mixture of important and unimportant things. In this picture that you see with all these papers, somewhere in all of that, there's a title to the car. There's an insurance paper here that she needs to find because she's had an accident a couple of months before, and the insurance company needs this paper. And so it's somewhere in that pile. So if someone goes in, and the health departments used to do this, they don't so much anymore, they would go in and throw all this away, and she would lose these important things. So this is part and parcel of the disorganization. The second disorganization is the behavior that we see. And this churning is what we call it, where the person picks up a piece of paper and puts it back Then looks at it, puts it back on the pile, puts another one back on the pile. So just churns the pile, but doesn't get rid of anything. And finally, it seems to in part be driven, at least some of the way in which this is done, by a fear of putting things out of sight. I didn't show you her bedroom. It looked like much of the rest of the house. But on top of her dresser, were clothes piled all the way to the ceiling, but her dresser drawers were empty. And what she said was, if I can't see it, if I can't see the clothes, I'll forget that I have them and they'll be useless to me. So her behavior in churning this pile was to take something and put it on top of the pile so she could see it. And that was used as her cue for remembering these things. So this out of sight fear is an important component here that sort of interacts with the disorganization. And we see all of these rooms appear to have a random assortment of things all piled together. Now, most of us live our lives categorically, where we categorize things and then we know where to go to find them. But for this woman, her world, and for many people with hoarding disorder, is organized visually and spatially. So she's got a pile of things and she kind of remembers where things are. So that insurance paper she thinks is about a foot down, somewhere in the middle of the pile, because she's created this kind of three-dimensional map in her brain about where things are, even though it may not be terribly accurate and certainly inefficient. Okay, at this point, let me turn it over to Carolyn, who's going to pick it up from here.
Thank you, Randy. So next, we're going to talk about co-occurring disorders with hoarding disorder. And this chart is percentage of individuals that have co-occurring disorders. And what you see is that major depression has the highest comorbidity of 50%. But I also wanted to highlight that ADHD is highly comorbid as well, 30%. But of note, there are many individuals who have attention difficulties, but that don't meet the criteria for ADHD. And then finally, as we'll talk about in the next slide, PTSD has a co-occurrence, but less than some of the other disorders. And that's very interesting because if you look at trauma in hoarding disorder versus something like obsessive compulsive disorder, you'll see that there are a higher proportion of individuals in hoarding disorder that have trauma as compared to individuals with OCD. And both Randy and I have seen anecdotally situations in which individuals, as they start to unclutter, it actually unmasks some of the symptoms of trauma. And in some ways, the having the clutter and space is also insulating individuals from those thoughts and feelings. And so this is a really interesting dynamic and certainly something that requires further study. Then looking at hoarding in children, studies have suggested that there may be some shared vulnerability between hoarding disorder and ADHD. And some studies have actually suggested that ADHD may predict some of the core features of hoarding disorder. However, as we'll talk about, it's really important to have careful assessment to really determine if this is the clutter is motivated by more hoarding behaviors, as you heard Randy describe, or some of the inattention and other features in terms of ADHD. So next, I want to highlight a model that we use in the field to organize what we know about hoarding disorder. And this model starts, and we're going to go through these step by step, but just as an overview, it starts with some of the vulnerabilities that may lead people to hoarding behaviors. And we'll step through some of the information processing problems and the attachments, again, that Randy highlighted, and saving beliefs, and how these, in addition with reinforcing patterns, can feed into the acquiring and saving behaviors that we see. And finally, the result of those behaviors is the clutter. So in terms of vulnerabilities, there is a number of factors, including family history, poor health or disability, some of the indecisiveness, again, that Randy highlighted previously, perfectionism and procrastination. And this idea of like attention focus, where you can't really see the forest for the trees, as well as emotional regulation. So let's dive into some of the information processing deficits. These encompass things that directly impact the ability to make decisions, such as attention, categorization, and memorization, as well as perception, association, and cognitive inflexibility. I remember Randy telling me a very interesting anecdote about an individual that he had seen in terms of the way that the individual organized their things was in sort of a spatial organization, and so they knew exactly where things were in their pile. And so uncluttering is actually disrupting their filing system. And so I always think, like, if somebody came into my office and put all of my files into a stack, that would disrupt my ability to organize myself. So these are some of the sort of specificities of hoarding disorder. And the other thing to highlight, again, is with ADHD and hoarding disorder, is that these kind of early features predict, studies have shown that it predict the 3 core features of ADHD, and that it alone, the hyperactivity component, does not alone doesn't predict the hoarding disorder features, but it does go hand in hand with the impulsivity, which is associated with acquisition. And childhood ADHD is considered to be a risk factor for hoarding disorder. So next, the ADHD-related features of hoarding disorder include this concept of cognitive flexibility, so the ability to adapt to changes in the environment, so inhibiting irrelevant material that's coming toward you and being able to shift attention flexibly between tasks, and recognition that there's more inflexibility in people with hoarding disorder. One of the things that has been highlighted in the work to date is that ADHD can lead to oppositional behavior in kids, and that can be mediated by hoarding. This oppositional behavior is something that Randy and I have talked about, because with kids who are in schools and they have ADHD, and they don't have sufficient accommodation in terms of breaking apart homework or tasks or lessons into sort of 10-minute chunks that are sort of tailored to their attention, they can get very frustrated, and so may look like oppositional behavior. But how much of it is sort of the system and systemic issues that are leading to not having accommodations for kids with ADHD? And then lastly, there's a wide range of executive function deficits that characterize hoarding disorder and ADHD. So again, there's a kind of interplay and overlap, which is important for a clinician to know. So one of the most evidence-based treatments that we have for hoarding disorder is cognitive behavioral therapy for hoarding disorder. And that involves a number of things, and it is can be individual or group treatment. The first part really for any of these treatments is the assessment and case formulation. So having a careful assessment will help understand how all the behaviors are fitting together. The second key piece is motivational enhancement. And this is especially critical when, as you heard Randy talk about, individuals have these beliefs that they need to keep these items, and it's quite painful to let go of items. So there needs to be a shared agreement and understanding about why it's important to let go of objects and what is gained, not just what is lost. As well as more skills-based organizational skills training, which will give you some examples on the next slide. And through this type of treatment, the goal is to change the attachment to things and change the acquiring patterns. So let's go a little bit more into what are types of organizational skills training. So these are some things that parents who have a child of a child who has ADHD and have done parent management training can recognize. So behavior charts, use of calendar for scheduling, use of to-do lists, so sort of physical ramps and reminders to try and help keep things organized. And there's flexibility training. So these are regarding thoughts about possessions, problem-solving training. And then again, this is familiar to individuals who are clinicians or parents of children with ADHD, breaking large tasks into smaller ones that then will help with attention. This next graph is about cognitive behavioral outcomes. And so this is one of the key seminal studies in the field, one of the first of its kind, in which individuals with hoarding disorder were randomized to a waitlist control. That means they did not get any kind of intervention or cognitive behavioral therapy. As you can see, the percentage reduction really, remarkably went down when compared to the waitlist. The reason why this stops at 12 weeks is that at the 12-week mark, if patients aren't doing better, it is imperative as a clinical researcher in terms of ethical practice then to be able to give them the actual active treatment. And so those individuals then got cognitive behavioral therapy. And when you look across assessment of treatment responders is defined by the CGI self-rating scale and therapist rated scale, a high proportion of individuals, so 80 to 70% in a post and follow-up have been deemed as treatment responders. So what are the important factors for successful treatment? So certainly things like enhancing individuals' motivation, homework completion. So there's a lot of studies that adherence and actually doing the homework can help outcomes, as well as home visits by clinicians or others to assist in practicing the skills that are being taught in the therapy. And modulating things like the perfectionism and changing the emotional attachments. Now, just one slide on medications, just to say that, we're not there yet in terms of the evidence base. Medications that have currently been studied in hoarding disorder are in very small open label trials. And these are things like paroxetine, venlafaxine, but also psychostimulants. And just to highlight two of these that are used in ADHD as well. However, to date, there is no medication that is FDA approved for hoarding disorder. And Randy and I would certainly say that, to start with the thing that's most evidence-based is the cognitive behavior therapy. To consider medications in cases where you have comorbid conditions like depression that can be treated, to use one of these that have been studied to decrease hoarding disorder. But certainly, treating the co-occurring condition with medication and cognitive behavioral therapy, anecdotally, we've seen that combination to be very good. And so in summary, hoarding is an accepted psychiatric diagnosis. It develops from vulnerabilities, information processing problems, and beliefs about and attachments to possessions. From both comes from very negative and very positive emotions. There are attentional problems that are common in hoarding disorder. And cognitive behavioral therapy, including an emphasis on cognitive rehabilitation, is a very effective treatment. And for related resources, as Carol had mentioned, Randy and I recently wrote a book on hoarding disorder, which is a comprehensive clinical guide. It's been really a pleasure to write that, for the American Psychiatric Association Press. There's also really great books Randy Frost and Gail Sedeke have written called Stuff, Compulsive Hoarding and the Meaning of Things, and a second edition book called Buried in Treasures, Help for Compulsive Acquiring, which is a wonderful handbook and resource book by Oxford University Press. And we have this is the book and a link as well. And we'll just open it up for question and answer.
Thank you. This was so interesting and informative, and we have so many great questions. Before we start the Q&A, I'd like to thank Inflow once more for sponsoring this webinar. And we'll go right to the questions. What's the difference between being a pack rat or chronic saver or accumulating clutter due to one's ADHD and actual having a hoarding disorder? How do you differentiate between those?
Well, I'll go ahead and take this one. If you look back at the diagnostic criteria, the second criterion B, is that there has to be a reason why the person is saving the items. They're not getting rid of it because they need to save it somehow. So it's not just a function of being unable to do it or unable to organize or unable to get your behavior together, get rid of things. There's an actual reason why the person's saving it. That's the main difference between an ADHD kind of clutter problem and a hoarding clutter problem. In terms of pack rat or chronic saver, really these are labels for a similar behavior. This is a behavior that really exists on a continuum. So there are lots of people who save lots of stuff, and they might spill over the threshold and be considered a clinical hoarding problem, or not. But the definition of pack rat or chronic saver is really not something that's all that useful for us to think about. If it's a hoarding related issue, if these issues of information processing problems and the meanings of the possessions are in line with this, then it might be a situation where the person is on the road to getting serious enough to have a hoarding problem. So that's the way we think about it. We don't really think about the nature of a label of a pack rat or a chronic saver.
That actually leads to the next question, which is, can hoarding be prevented? How do you stop someone on the path to hoarding?
I'm happy to take this one, Randy. Which is, I think there's a wonderful opportunity to study the prodrome. So, like, what leads people to these, and certainly in areas such as schizophrenia, there's been more emphasis on kind of rapid identification and treatment for individuals. And we know that, hoarding disorder tends to be identified a little bit later in life, and it can get more severe. You can see more symptoms, with each successive decade in life. So I think it would be very helpful to have more sessions like the ones you're doing today to really help people understand what are the signs and symptoms. But the short answer is that we don't have currently a way to identify with a biomarker or something who is going to develop hoarding disorder. So really in the field where we meet individuals when they have the behaviors, and then the best thing to prevent people from getting worse is treatment with things like cognitive behavioral therapy.
I might add something to that. At least one study has found that ADHD in children predicts the development of hoarding. Now, that doesn't mean that someone with ADHD will invariably develop a hoarding problem, but what we see is that children with ADHD are more likely to develop a hoarding problem than children without ADHD. So it's one of the things that is a good area for us to start researching to find out, to really plumb the nature of that relationship. So
interesting. Here's a question, and we had various versions of this question. This person writes, I have one parent who has a hoarding disorder and one parent who has ADHD. They are elderly, in violent denial, and their living conditions are in a state of extreme clutter. They have lost the use of almost their entire living space due to clutter, and now clutter is even piling up outside of the house. If one of them were to have a health crisis, emergency health workers would have difficulty reaching them. What would be the best way to get through to them that they are a danger to themselves? And this is similar to the pictures you had shown earlier.
Let me start off with this one. This is a common problem. This is a fairly common experience of family members with hoarding cases. As their parents get older, they worry about the effects of living in this cluttered environment. And it's a really tough nut to crack. But here are a few things that I would say about it. First of all, the focus on clutter is maybe something that gets in the way of developing the motivation to do something about this. And it makes a bit more sense, and in many ways families do this, to focus on function. What is it that you can't do now that you would like to do? And one of the things we do in starting treatment is we always start focusing on the person's values in life. What is it that they want out of life? What are the most important things that they want to do in life? And sometimes if it's a real stubborn problem, I'll even suggest that for someone who is older, in their late 70s, early 80s, how much time do you think you have left here and how do you want to spend it? And so you really want to get on board with them, to have a shared goals, because throwing things out is not a shared goal. So if my parents have this problem and I come to them and say, we need to really get rid of a lot of this stuff, I'm not sharing the goal that they have. But if we have a discussion about what they want to do in their remaining lifetime, and I say, I want to help you do that. How best can we do that? Then there's a shared goal that you can develop in working toward this. And there are a couple of other issues that are important when facing this kind of situation. One of the things we know is that families fracture pretty easily over this because, family members do their darndest to try to help. But the problem is it's not clear how to help these folks in this situation, but particularly if they don't think they have a problem. It's a conundrum. And so what people resort to is being somewhat coercive and throwing things out when they're not looking, or going in and trying to do cleanouts and so forth. These usually backfire. You can do a total clean out of a house in relatively short order, and you may change the condition of the home temporarily, but you haven't changed the behavior, and the home will fill up again in a relatively short period of time. So one of the things we do to encourage family members is to make sure that whatever happens, even if you can't make a dent in the hoarding behaviors, that you continue maintaining the relationship and visiting them in their home. That doesn't mean visiting there and talking about the clutter, but just visiting there and making those visits pleasant and as positive as you can. Because one of the things we know is that if someone goes from having visitors to their home to not having visitors to their home, the clutter gets worse. And so we encourage people to maintain that relationship.
Okay. A mom writes that her 7-year-old son, who was diagnosed with ADHD 2 years ago and was also diagnosed with anxiety, has been struggling with getting rid of things and even struggling with seeing other people throwing things away. She said that he physically tried to stop a teacher at school from throwing away food in a bin. The food wasn't even his. It was a classmate's who had dropped it on the floor by accident. He gets upset about discarding anything and anxious about what will happen to the discarded object. Is it too soon to know what this could be? What can we do to help him?
I'm happy to field this one, Randy. Maybe you can jump in as well. So I think in this situation, the best thing to do is just, work closely with, it sounds like they've already been diagnosed with ADHD, work closely with the mental health professional, and really think about, what, these behaviors are interfering again with, it sounds like now at school, and causing distress. And so it's important to circle back again. I can't diagnose, somebody since I'm not seeing them. But I think that those issues are definitely ones that I would encourage further follow-up, help, support, working with the clinician to try and understand what these behaviors about, and seeing if there are different kinds of therapy. In for children with ADHD, there's for younger kids, there's parent management training, which is kind of behavior charts for parents to do with the kids. But there is elements of cognitive behavioral therapy from hoarding disorder, OCD, that potentially could be used to supplement or augment treatment. Randy, what would you say?
I might add here that one of the things we see with kids with hoarding problems is an abnormal level of personification. That is the anthropomorphizing of objects. Now, we see this with adults with hoarding disorder as well, but kids frequently will worry about the feelings of the object. So in the example, I would not be surprised if this young person felt like the food was being hurt somehow, or if there was some negative emotion the food was experiencing that was thrown on the floor that's related to this. And certainly that kind of personification is a normal part of childhood. And, much imaginative play is based on the personification of objects. But in these cases, it's quite clear that this is excessive. And so one of the things that therapists would focus on is that issue of personification of these objects and the meaning these objects have. So I think there aren't too many studies of hoarding in kids, but there are an increasing number just in the last year or two of studies looking at how to treat hoarding behavior in kids. And the focus is, again, much like the focus that we see in this case, cognitive behavior therapy, looking at the nature of the meanings of the items, and practice in making decisions about the importance that particular item has in the context of your life.
Some viewers have written in that they observed hoarding behavior in a parent. And so they're asking, is hoarding as much nature or nurture? If you see this behavior, are you likely to follow this behavior as you get older, or not necessarily?
Let me start chiming in. Carolyn can talk about this perhaps better than I can, but there is sufficient evidence now, I think, that hoarding is at least partly genetic. There are family studies, there are linkage studies, some twin studies, all of which suggest that a portion of this disorder is genetically determined. Now, exactly what feature of hoarding is genetically determined is not clear. My guess is that it has to do with these information processing deficits that we see, these executive function problems that we see in hoarding. That seems to me to be the most likely candidate for exactly where the genetic component comes in. But Carolyn may have more specific details about that.
Yeah, I think that is the state of what we know in the field. The other thing I would just add is that, for mental disorders, more broadly, there is a genetic and environmental component. And so it's quite possible that a child who is raised in an environment with an individual who has extreme hoarding hasn't seen or been taught the skills of organization, maintenance, as well. So that there could be a component of that as well. And some kids actually even go the opposite, right? They instead of having difficulty with hoarding are like extreme unclutterers, and can kind of swing to the other side as well. So just to, in addition to genetics, there's also the environmental piece too.
Someone asked, should you treat the mental health conditions first, like depression or OCD, before you attempt to treat a hoarding behavior?
Yeah, I would say yes. I mean, there are a lot of treatments that sort of overlap, right? So if you have depression, you want to be on an antidepressant, and we have some initial open studies that certain antidepressant medications can be helpful with hoarding disorder. But if you ignore the risk of ignoring a co-occurring illness such as depression or OCD or others, is that you won't get the same bang for your buck for the hoarding treatment. There's no reason why they couldn't happen at the same time. So it doesn't. There's no research studies showing whether concurrent treatment or stepped treatment is better than the other, unless Randy knows of a study like that. So I would say, whatever disorder has been identified, trying to go with the first line evidence-based treatments and treating everything that's possible to be treated.
Yeah, I would agree. I think in some cases, one of the things we found, and I think Carolyn mentioned a couple of these studies, is one, we have started treatment for hoarding and gotten partway through. We had a case of an individual who had hoarded most of her life, started in childhood. But when she was a young adult, she had a traumatic event happen. And it was a sexual assault that occurred in her bedroom. And as treatment progressed, the closer we got to the bedroom, that's when the PTSD symptoms started showing up. And so at that point, we had to stop the treatment for hoarding and focus more exclusively on the PTSD and to get those symptoms resolved before coming back to the hoarding treatment.
Okay. I think I have time for at least one more question. Someone writes, the pandemic has kicked my partner into full-on hoarding behavior and she's now impossible to live with. If I push her hard to clean up, she breaks down and falls apart. What can I do?
Let me start out with this. I think the best strategy is to find a therapist who knows how to treat hoarding disorder to work with her. Now, the International OCD Foundation has a therapist finder function, and you can find therapists within 10 miles, within 25 miles, even within 50 miles of your home. And the software will tell you whether they have specialty training in treating hoarding. And so that's the first line, because this is an issue that's beyond the ability of a spouse or friend to deal with. So the best line is to get them involved in treatment.
I would second that, and also would say that there are many different things that could be causing the roommate's behavior, including just straight up depression, not hoarding, right? So people that are feeling down, blue, depressed, don't have motivation to kind of pick up things or throw things away. They just have anhedonia, so just like lack of pleasure in things and not going outside. And so as Randy mentioned in the beginning, it's important to rule out or exclude that this is, depression, and that this is really, the pathway to go. So that's why it's important, as Randy said, to connect with a mental health professional that can do a full differential diagnosis. Certainly, the individual's roommate isn't the only person who has suffered in the pandemic. A lot of mental health struggles have been faced by a lot of people, and as well, people who have had COVID. There a lot more evidence now of psychiatric manifestations, including long COVID syndrome, where people can have brain fog and clouding. And other difficulties that are just really at the tip of the iceberg. And so is it possible that in a post-infectious disease, the person doesn't have the energy to pick up after themselves and is really needing, mental and medical help.
Okay, well, unfortunately, we are out of time, but we thank you for joining us today and for sharing your expertise with our ADHD community. Thank you both so much. If you are listening in replay or podcast mode, visit attitudemag.com and search podcast number 417 to access the slides, the webinar replay, and the certificate of attendance option. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. The latest summer issue is filled with practical advice and tips from experts on social anxiety, toxic relationships, how to bully-proof your kids, and so much more, including a special section on success at school, everything you need to know to prepare your child for a successful year. Subscribe today for your family or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Make sure you don't miss future Attitude webinars, articles, or research updates by signing up to receive our free email newsletters at attitudemag.com/newsletters. Thank you.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.
America. We are endowed by our Creator with certain unalienable rights: life, liberty, and the pursuit of happiness. At Grand Canyon University, we believe in equal opportunity, and the American dream starts with purpose. By honoring your career calling, you impact your family, your friends, and your community. The pursuit to serve others is yours. Find your purpose at Grand Canyon University. Private, Christian, affordable. Visit gcu.edu.